Ademola's journey from a medical student to a healthcare mogul was not just a personal transformation, it was a reflection of the shifting paradigms within Africa's healthcare landscape. Growing up in a modest home in Lagos, he was surrounded by the realities of a system that often felt underfunded and overwhelmed. His parents, both teachers, instilled in him the importance of education and hard work. Yet they also understood the limitations of traditional paths. They had seen too many bright minds stifled by the conventional 9-to-5 grind, and they were determined that their son would not fall into that trap. As Ademola navigated his medical studies, he often found himself torn between the rigorous demands of his coursework and the entrepreneurial spirit that his parents had nurtured in him. The late-night study sessions, the endless memorization of medical terminologies, and the pressure to excel in exams weighed heavily on him. Yet, in the quiet moments of reflection, he could hear his parents' voices urging him to think beyond the stethoscope. They encouraged him to envision a future where he could not only heal patients, but also reshape the healthcare system itself. During his final year of medical school, an internship at a local hospital opened his eyes to the glaring deficiencies in the healthcare sector. He witnessed firsthand the long lines of patients waiting for basic diagnostic tests, the lack of modern equipment, and the overwhelmed staff struggling to provide adequate care. It was a stark contrast to the ideals he had been taught in class. This experience ignited a fire within him, a desire not just to treat individuals, but to create a system that would serve the many. After graduation, while his peers flocked to hospitals and clinics, eager to don their white coats and begin their medical careers, Ademola took a bold step. He enrolled in a business development course specifically tailored for healthcare professionals. It was a decision that raised eyebrows among his classmates and professors, many of whom believed that a doctor's place was in the hospital, not in the boardroom. However, Ademola was undeterred. He immersed himself in learning about healthcare entrepreneurship, understanding the nuances of business management, finance, and marketing. With the modest savings his parents had set aside for him, along with a small loan from a family friend, Ademola opened his first diagnostic center in Ibadan. The center was modestly equipped, but he focused on creating an environment that prioritized patient care and accurate results. He hired a small team of dedicated professionals who shared his vision and commitment to excellence. The initial months were tough. He faced skepticism from the community, and there were days when the center barely broke even. But Ademola's resolve was unwavering. He spent countless hours networking, reaching out to local doctors, and educating the public about the importance of preventive health care. Slowly but surely, word began to spread. Patients appreciated the quality of care they received, the compassion of the staff, and the efficiency of the services. As the center gained traction, Ademola reinvested the profits into expanding his services and upgrading equipment. He introduced mobile units to reach underserved areas, providing diagnostic services to those who otherwise would have to travel great distances. Within 3 years, Lifeline Diagnostics had grown from a single center to 5 locations across southwestern Nigeria. Each center was a testament to Ademola's vision of accessible, high-quality healthcare. He embraced technology, implementing telemedicine services that allowed patients to consult with doctors remotely, a revolutionary step in a region where access to healthcare was often limited by geography. As the success of Lifeline Diagnostics grew, so did Ademola's ambitions. He recognized that the challenges faced by Nigeria were mirrored in other African countries. With a keen eye on the broader continent, he began to explore opportunities to expand into Ghana, Kenya, and Rwanda. Each new venture was approached with the same dedication and care that had characterized his first center. He sought to understand the unique healthcare challenges in each country, adapting his model to meet local needs while maintaining the core values of Lifeline Diagnostics. By the 7th year of his journey, Ademola had transformed into a respected figure in the healthcare industry. He was invited to speak at conferences, sharing his insights on healthcare innovation and entrepreneurship. His parents, now in their early 60s, sat in the audience with pride, witnessing the realization of the dreams they had nurtured in him. They had always believed in the importance of planting the right seeds early, and now they saw those seeds blossoming into a thriving enterprise that was making a tangible difference in people's lives. Ademola's story became a beacon of hope for aspiring healthcare professionals across the continent. He established mentorship programs, encouraging young medical students to think beyond traditional roles and consider how they could contribute to the healthcare system in innovative ways. He believed that the future of African healthcare depended not just on doctors, but on visionaries who could bridge the gap between medicine and business. As Lifeline Diagnostics continued to expand, Ademola remained grounded in his mission to improve healthcare access and quality across Africa. He understood that true success was not measured solely by profits, but by the lives transformed and the communities uplifted. Through partnerships with local governments, NGOs, and international organizations, he worked tirelessly to advocate for policies that would strengthen healthcare infrastructure and promote preventive care. Ademola's journey was a testament to the power of vision, resilience, and the willingness to challenge the status quo. He had taken the advice of his parents to heart, forging a path that combined his medical expertise with entrepreneurial spirit. Today, as he stands at the helm of a thriving healthcare empire, he reflects on the journey that brought him here. It is a journey marked by hard work, dedication, and an unwavering commitment to making a difference in the world. And in doing so, he has not only transformed his own life, but has also become a catalyst for change in the African healthcare landscape, proving that dreams, when pursued with passion and purpose, can indeed become a reality.